You know that feeling when your normally food-obsessed dog or cat just suddenly leaves their bowl untouched?
Mm.
Or maybe they're just acting
Mhm.
well off, a little hunched up perhaps, or restless.
Hmm.
It can be really quite worrying when you can't see an obvious reason.
Absolutely. And that's often when the issue is kind of hidden beneath the surface. So today we're going to take a deep dive into exactly that sort of problem, a condition called Ileus in cats and dogs.
Right.
You shared some really detailed information on this, and I think our goal today is to sort of cut through the medical jargon.
Yeah, let's unpack it.
Exactly. Understand the core of what's actually happening.
Yes, we want to go beyond just like a definition of ileus and really get to grips with why it happens and what it means for your pet's health.
Mm-hmm.
Think of this as your shortcut, maybe, to understanding what's going on if your vet ever mentions this term, so you feel informed, not completely overwhelmed.
So let's jump right in. What is Ileus? I think the crucial thing to understand right up front is that Ileus isn't really a primary illness in itself.
Okay.
It's more like a red flag. It signals that something else in the body is causing a problem.
A red flag. Okay, so it's not like the intestine itself is diseased necessarily, but it's reacting to something else going on.
Precisely. Yeah. Imagine the intestines have this internal rhythm, right? A wave-like motion pushing food along. It's called peristalsis.
Right, peristalsis.
Ileus is basically when that rhythm just breaks down, the muscles stop moving properly, and the food, the contents, they just sit there. It causes a temporary blockage.
Okay, a temporary blockage.
But, and this is key, this blockage isn't usually because something is physically in the way. It's more of a functional issue. The movement has stopped.
Our sources make a really important distinction here between this functional or adynamic ileus
Yeah.
and mechanical obstruction. What's the core difference we need to grasp?
Okay, think of it like this. A mechanical obstruction is, well, a physical barrier, like a blockage in a pipe, maybe a toy your dog swallowed, or a tumor, something actually blocking the path.
Gotcha, like a roadblock.
Exactly. Adynamic ileus, which is what we're focusing on today, is different. It's when the pipe itself stops working properly. The muscles that are supposed to move things along, they aren't firing like they should. It's a paralysis of movement.
Got it. So the muscles have gone on strike, basically. If it's not a physical thing blocking the way, what makes these intestinal muscles just stop? What's the underlying mechanism?
Yeah, this is where it gets really interesting biologically speaking. Adynamic ileus often involves what we call electromechanical dissociation. Fancy term, right?
Mm-hmm.
It basically means there's a disconnect. The electrical signals telling the intestinal muscles to contract might still be there, but the muscles themselves aren't actually moving properly in response.
Huh. Like the message isn't getting through, or they're just not listening.
Sort of, yeah, or they can't respond. Several things can throw off this delicate balance. One really important factor is an overactive fight-or-flight response, the sympathetic nervous system.
Okay.
When a pet is really stressed or sick or in pain, this system can kick into high gear, and one of its effects is actually to slow down digestive system activity.
Wow. Okay, so stress, actual physical or emotional stress, can literally make their gut, like, grind to a halt.
It absolutely can. Then you've got substances circulating in the bloodstream. These are often released when the body's dealing with, say, inflammation or pain, things like catecholamine's and adrenaline, basically, and even the body's own natural opioids or painkillers.
Right.
These can also send signals telling the intestines to slow down. It's almost like the body's trying to cope with one problem, maybe inflammation somewhere else, but it ends up causing this secondary issue in the gut.
So the body's own response mechanisms can sometimes backfire a bit.
It's a really complex interplay, and there's more. The body also produces its own chemicals, hormones like motilin that normally help keep things moving, prokinetic hormones.
Okay, the go signals.
Yeah, the go signals. If the release of those is impaired for some reason, that can contribute to the slowdown to ileus. And finally, something our sources really highlight is hypokalemia.
Low potassium.
Exactly, low potassium. Even a seemingly simple imbalance in blood potassium levels can have a massive impact on muscle function everywhere in the body, including the smooth muscle in the intestinal walls.
Okay, that makes sense. So those are the sort of internal mechanisms. But what real-world things, what health issues or situations can actually trigger these problems in our dogs and cats? What are the common causes we should maybe be aware of?
Well, the range of potential triggers is actually pretty wide, which really underscores that ileus is often, a secondary sign.
Right, a symptom of something else.
Exactly. The underlying causes, they can be grouped in various ways: infectious, inflammatory, metabolic, and so on. But maybe thinking about common scenarios for pet owners is more helpful.
Yeah, definitely.
Okay, so one of the most frequent is surgery, especially any surgery involving the abdomen or the digestive tract itself.
Ah, okay. Post-op.
Yeah, post-op ileus is common. Just handling the intestines can temporarily disrupt their normal rhythm. They kind of get stunned for a bit.
That makes sense. They probably need a little recovery time after being, well, manipulated.
Precisely. Then we already mentioned electrolyte imbalances. Low potassium hypokalemia is a big one.
Right.
But low magnesium and low calcium can also play a role in messing up muscle contraction.
Okay.
Then you have inflammatory conditions, not just inflammation within the intestines, like inflammatory bowel disease, but also inflammation near the intestines, like the pancreas.
Pancreatitis.
Yes, pancreatitis is a classic example. A really painful bout of pancreatitis can definitely shut down gut motility nearby and lead to ileus as a secondary complication.
So a sick pancreas can actually cause the gut next to it to slow right down.
Absolutely, the inflammation spills over, essentially. And interestingly, the sources also point out something quite important. If a physical blockage, that mechanical obstruction we talked about,
Yeah.
if that isn't relieved quickly, if it stays there for a long time, it can actually cause the muscles further down the line or even upstream to become sluggish and eventually stop working properly too, leading to adynamic ileus on top of the mechanical one.
Wait, hang on. So a physical blockage can eventually cause the functional problem, the muscle shutdown that we've been discussing.
Exactly. It's a bit counterintuitive, maybe, but if the intestines are constantly stretched out and inflamed by that physical blockage, the muscles can just get exhausted. They lose their tone and their ability to contract effectively, even sometimes after the initial blockage is gone. It really shows how interconnected it all is.
So yeah, that's a really important connection to understand. Okay, what else? What other triggers are there?
Well, we touched on stress. And surprisingly, things like being very cold or exposure to loud noise can sometimes contribute, especially in, already sensitive animals.
Simple environmental stress.
It seems so, yeah. Also, certain medications are known culprits, particularly drugs called anticholinergics. They work by blocking a key nerve messenger, acetylcholine, which is vital for gut movement, so blocking it slows things down.
Okay.
And finally, there's a less common but pretty serious condition mentioned called lymphocytic leiomyositis. It's basically an autoimmune issue.
Autoimmune. So the body attacking itself.
That's the gist, yeah. In this case, the body's immune cells, specifically T lymphocytes, mistakenly attack the muscularis propria of the intestinal wall. This happens in dogs, cats, other species too. It causes chronic inflammation and fibrosis, leading to a progressive slowing down of the whole digestive tract.
Wow, okay. That sounds serious.
It definitely can be.
So, okay, with all these different potential causes, what are the signs? What might a pet owner actually see at home that would make them think, maybe something like ileus is going on?
Yeah. The signs can be a bit variable, sometimes vague even, but some of the most common things owners notice are lack of appetite, anorexia. That's a big one.
Right.
Also vomiting or sometimes regurgitation, which is bringing food back up more passively. General lack of energy, lethargy.
Just not themselves.
Exactly. Some pets might actually have diarrhea initially, oddly enough, while others might stop passing stool altogether. Over time, you might notice weight loss, and some animals will seem uncomfortable in their belly, maybe mild bloating, or they just seem tender there.
Okay. And what about what a vet might find during an exam? You mentioned listening.
Yes, auscultation, listening to the abdomen with a stethoscope, is really important. Normally you hear all sorts of gurgles and rumbles, gut sounds, bobarigme.
Yeah.
In ileus, these sounds are often really reduced or sometimes completely absent if you listen for a good couple of minutes. It sounds very quiet. The silent abdomen.
Often, yes. But it's worth mentioning, sometimes in the very, very early stages, the gut might actually sound hyperactive, more noisy, before it shuts down. So it's not always silent immediately.
Okay, so it's not a perfectly straightforward sign then, the gut sounds.
Not always, no.
Okay.
Now, if the vet suspects ileus based on the history and exam, the next really crucial step is figuring out why and critically ruling out that physical mechanical blockage.
Right, because the treatment would be totally different. You mentioned things like swallowed toys or twists in the intestine.
Exactly. Or maybe severe inflammatory bowel disease causing a narrowing intussusception where the bowel telescopes into itself. Hernias, volvulus, which is a twist, even parasites sometimes. Lots of possibilities for physical blockage.
So how do vets tell the difference between that and the functional slowdown of adynamic ileus?
They use a combination of tools. Routine blood tests, CBC, biochemistry panel, and a urinalysis are usually first steps.
What do those show?
They can give really important clues. They check for those electrolyte imbalances we talked about, especially the low potassium.
But hypokalemia?
Yep. They also check kidney function, look for signs of dehydration or inflammation elsewhere in the body, things like that. There are also specific blood tests like pancreatic lipase tests, spec-CPL or FPL, to help rule pancreatitis in or out.
Okay.
And in young puppies presenting with ileus and diarrhea, a test for parvovirus is absolutely essential.
Makes sense. And what about imaging? You mentioned X-rays or ultrasound.
Imaging is hugely helpful here. Abdominal radiographs or X-rays are often the first imaging step. They let the vet see patterns of gas and fluid building up inside the intestines.
What kind of patterns?
Well, how the gas and fluid are distributed can give clues. Is it generalized throughout the bowel? Is it localized to one area? Is it mostly gas or mostly fluid? Each pattern can suggest different underlying causes, like generalized gas might be seen with certain drugs or peritonitis, whereas localized fluid might point more towards an early obstruction or maybe pancreatitis affecting one loop of bowel.
I see. And ultrasound.
Ultrasound gives a much more detailed view. It's really good at looking at the intestinal walls themselves. How thick are they? Are the layers distinct? This can help spot things like tumors, inflammatory bowel disease changes, or the thickening you might see with that autoimmune condition, leiomyositis.
Ah, okay.
And crucially, ultrasound is often very good at distinguishing between adynamic ileus, where you see dilated, fluid-filled loops, but they're not really moving, and a mechanical obstruction, where you might see a specific blockage point with dilated loops before it and normal or empty loops after it. It can also easily pick up pancreatitis or fluid in the abdomen, suggesting peritonitis.
So imaging is pretty key for sorting things out. Are there other, maybe more specialized tests they might use?
Yes, sometimes. Vets might use something called BIPS. These are small radiopaque markers, basically tiny plastic shapes that show up clearly on X-rays.
Okay.
You feed them to the pet and then take a series of X-rays over hours or even days to track how fast or slow they move through the digestive tract.
Like tracking transit time.
Exactly. In adynamic ileus, these BIPS will move much slower than normal. They might hang out in the stomach for a really long time, confirming delayed motility.
Got it.
Sometimes an upper GI contrast study is done, using liquid barium, to outline the inside of the gut and look for partial obstructions or assess motility, although interpreting motility on these can be tricky because stress alone can slow things down.
Right.
Experimentally, things like electrogastrography exist, kind of like an ECG for the gut, but that's not common practice. If there's fluid in the abdomen, abdominocentesis, taking a sample of that fluid, can diagnose peritonitis.
Yeah.
And in some tricky cases, endoscopy, using a camera scope, or even exploratory surgery, a laparotomy, might be needed to definitively rule out a mechanical obstruction or to get biopsies.
Biopsies seem important for some conditions.
Absolutely. Especially for diagnosing that intestinal leiomyositis we mentioned, you typically need full thickness biopsies of the intestinal wall for a definitive diagnosis. And of course, depending on what the vet suspects, other specific tests might be needed, like spinal X-rays if they suspect a neurological cause, or tests for dysautonomia.
Wow, it sounds like a really thorough investigation sometimes to really pinpoint the problem.
Yeah.
So once they do know it's adynamic ileus, and hopefully they found the underlying cause, what are the treatment strategies?
Well, the absolute number one goal, the most important part of treatment, is always to identify and treat whatever underlying condition is causing the ileus.
Address the root cause.
Exactly. Because if you don't fix the primary problem, the pancreatitis, the electrolyte imbalance, whatever it is, the ileus is just likely to persist or come right back.
Makes total sense.
Alongside treating the primary cause, correcting any fluid and electrolyte abnormalities is crucial, especially getting that potassium level back to normal if it's low. Intravenous fluids are often essential.
Okay. And what about medications specifically to, kickstart the gut again, get it moving?
Yep, that's where prokinetic drugs come in. These are medications designed to stimulate those muscle contractions in the digestive tract.
Are there different kinds?
Yes, several options, and they work in slightly different ways and affect different parts of the gut. For example, cisapride is quite potent and works on the stomach, small intestine, and the colon. Metoclopramide mainly works higher up on the stomach and small intestine and isn't very effective for chronic ileus. Erythromycin, an antibiotic, actually has prokinetic effects at lower doses too, mainly on the stomach and small intestine.
So the vet chooses based on the situation.
Precisely. They'll choose based on where the ileus seems worst and the suspected cause. And for those specific immune-mediated issues like the leiomyositis,
Yeah.
medications to suppress the immune system like cyclosporine or prednisone might be the primary treatment needed.
Okay. Are there any other treatments sometimes used?
Well, in some severe cases where there's a huge amount of gas or down the nose into the stomach, this can help decompress it, relieve pressure and nausea. It's not always needed, but it can be helpful sometimes. It's also important to know what not to give.
Oh, contraindications.
Yes. We mentioned anticholinergic drugs can cause ileus. You definitely want to avoid those. And certain strong opioid painkillers, while necessary for pain sometimes, can also significantly slow gut motility, so their use needs careful consideration in these patients.
We wouldn't want to give something that actually makes the slowdown worse.
Yeah.
Okay, so after they start treatment, how is progress monitored? How do they know if it's working?
Careful monitoring is key. This definitely includes rechecking those electrolyte levels regularly, especially potassium, to make sure they're normalizing.
Makes sense.
And listening to the abdomen frequently with the stethoscope is vital. Are those gut sounds returning? Are they sounding more normal? That's a really good sign. Repeat x-rays might also be taken sometimes to objectively see if the gas and fluid distension in the intestines is actually decreasing.
So checking both inside and out, basically. Are there any potential complications from ileus itself that we should be aware of, things that could go wrong?
Yes, unfortunately. When the gut isn't moving properly for a while, the normal balance of bacteria in there, the gut microbiome, can get disrupted. This is called dysbiosis.
Okay.
And in more severe or prolonged cases, there's a risk that bacteria can actually leak from the inside of the intestine across the damaged wall into the bloodstream or abdominal cavity. That's called bacterial translocation.
That sounds bad.
It is. It can lead to sepsis, a life-threatening systemic infection. So getting the gut moving again isn't just for comfort. It's important to prevent these serious complications too.
Right. Really critical then. So thinking of the overall outlook,
Yeah.
what's the prognosis generally for a pet diagnosed with adonamic ileus?
It really depends heavily on the underlying cause and how successfully that primary disease can be identified and treated.
So it comes back to the root cause again.
Absolutely. If the underlying issue, say mild post-op ileus or an electrolyte imbalance that's easily corrected, is managed effectively, then the ileus itself often resolves quite well and the prognosis is good. But if the underlying cause is very severe, like aggressive cancer or uncontrollable pancreatitis or that autoimmune leiomyositis, which can be progressive, then the prognosis for resolving the ileus long-term is obviously much more guarded.
Okay, that makes sense. It's tied to the primary condition.
Completely.
So to kind of wrap up our deep dive here, ileus in pets, this adonamic ileus we've focused on, it's fundamentally a sign, isn't it? A sign that the normal movement of their intestines has slowed right down or even stopped. And it's usually happening as a result of some other health issue going on elsewhere in their body.
Exactly right. And because, as we've discussed, so many different things can potentially trigger it. Everything from, major surgery to pancreatitis to just stress or even subtle imbalances in their body chemistry like potassium. It really does highlight just how interconnected all of a pet's bodily systems truly are. Recognizing those signs we talked about and then getting a really thorough diagnosis to figure out that underlying trigger, those are absolutely the keys to treating it effectively.
This has been incredibly helpful, I think, in demystifying this condition. It makes you think, though, considering this huge range of potential triggers for ileus, from something obvious like surgery to something less obvious like electrolytes or even just noise. What does that tell us about just how finely tuned, how interconnected a pet's overall health really is? And maybe how important it is to take that kind of holistic view when they're unwell.
That's a fantastic point to end on. It really underscores that, doesn't it? Our pet's well-being is this delicate balance. Problems in one single area, even seemingly unrelated ones, can easily have these ripple effects throughout their entire system, manifesting as something like ileus. It's a powerful reminder, I think, that looking for and trying to address the root cause of any health issue, not just chasing the symptoms, is always the best path forward for their long-term health and comfort.